bifid here, you have transverse foramen here. Anyway, okay, that's the body, spinous process. This is here the superior notch, superior articulating facets. From the knots we have that spinal nerve, as we said, right? Remember that? Okay. Now here's the vertebral canal. You have the spinal cord, starting from outside and inside. Spinal cord is covered by tough, called meninges. Those are connective tissue. The outermost one, right here, the outermost one, dura mater. Next, deepest to it is the arachnoid mater. And the deepest, which is this one here, adheres to the spinal cord, pia mater. Pia mater. So above the dura mater there is a space. That space has fat and blood vessels called epidural space. Between the arachnoid and the dura you have a little space also, right here. That's the space. This is called subdural space. Between the arachnoid and the pia mater, in this area, you have subarachnoid space. Okay, this is the spinal cord covered by the pia mater. This is called white matter. This butterfly shape called gray matter. Here, that's a fissure, anterior median fissure, and in the back, posterior sulcus. The white matter, it's white because it has axons that are myelinated. And the bundle of axons here, they go up and down, many different bundles, they go up and down to the brain, and they call tract. So in the peripheral nervous system, we call them nerve, and the central nervous system called tract. The gray matter, this is anterior horn, posterior horn, lateral horn. Anterior horn is motor, has neurons that will give you the axon for motor commands. The lateral horn, that's true for the lumbar and the sacral region of the spinal cord, has the motor and sensory, has cell bodies for the autonomic nervous system, sympathetic branch.
So you said lumbar and sacral?
Yeah. The posterior horn is sensory. It will receive the sensory information. Does not have any cell body for neuron. No cell bodies in here. Okay. Now, those are the anterior roots. Those are the cell body here in the anterior horn will give you those anterior roots. Those are posterior roots. They bring the information to the dorsal horn. So the anterior root and the posterior root, they merge after this ganglia called dorsal root ganglia. The dorsal root ganglia has the cell bodies of those sensory neurons. So when they merge, they give you the spinal nerve. That spinal nerve. The spinal nerve will divide to posterior ramus, anterior ramus, or dorsal ramus, ventral ramus. Those spinal cord now is a mixed because it has both the anterior and the dorsal, so it's mixed, sensory and motor. Also the rami are mixed.
Say again.
Are mixed because they have sensory and motor. From the anterior ramus, you have the anterior communicante. This that's rami communicante. They call that because it's going to connect between the side chain ganglia, this here called side chain ganglia, to the posterior, to the anterior ramus. That's the communicante. Okay? Those ligaments right here, on each side, they're coming from the pia mater, penetrate the arachnoid and go to the dura, and so this is called the denticulate ligament. Denticulate ligament.
And where's that?
Okay? That's it.